China has now, as of today, led to the deaths of more than 600,000 Americans. That is the new number on this Tuesday. And the battle over where the fault lies is only just beginning. For months, Dr. Anthony Fauci and Dr. Francis Collins and most of the media said that the idea that it could have come from the Wuhan lab was a theory, often talked about by President Trump, that they felt was not plausible, even though the virus was first spotted just a stone's throw from the lab, where a Chinese scientist had long been working with bats and coronaviruses, even amping them up to make them more deadly. Now, Dr. Robert Redfield, the head of the CDC under President Trump, was one of the first officials to support this theory that perhaps COVID did leak from the lab. He says that since coming out with that theory, he has received death threats as a result, and he has kept largely silent since, until now, in this exclusive interview with Fox News medical contributor Dr. Mark Siegel.
Here, I think there's clearly two different hypotheses that are credible. One, that this virus evolved from bats into some intermediate animal that is yet to be found, and then eventually evolved into humans, and then basically became efficiently transmitted among humans. And the other is that this virus actually went from a bat into a laboratory, where in the laboratory it gained the ability to become an efficient human-to-human transmitter. And those are both two hypotheses. And I guess if I'm disappointed about anything about the early scientific community, is that there seemed to be lack of openness to pursue both hypotheses. You know, it's interesting, if you look at COVID, if you look at SARS, the SARS went from a bat to a civet cat, and it went into man. But it never really learned how to go efficiently man-to-man. And as we sit here today, there's been less than 10,000 cases of SARS in over 18 years. When you look at MERS, which is another coronavirus, went from a bat to a camel, and then from a camel to man. And as we sit here today, it still hasn't learned how to go efficiently human-to-human. We've had less than 4,000 cases. Really, we saw some unprecedented situations where a number of very prominent scientists felt that they needed to write a letter to Lancet, and that journal felt it needed to publish that letter, which basically said anybody that put forth the hypothesis that this virus may have evolved from a lab were promoting conspiracy theories. I'm just giving my best opinion as a virologist, and I don't think it's plausible that this virus went from a bat to an animal we still don't know that animal, and then went into humans, and immediately had learned how to be human-to-human transmissible to the point of now causing one of the greatest pandemics we've had in the history of the world.
Do you think the probability here is that this leaked from a lab?
Well, my professional opinion as a virologist is that's the hypothesis that I support. You know, other individuals, Tony Fauci, for example, would say that he prefers to support that it evolved from nature. I think those are the two hypotheses. And I should work hard to prove my hypothesis wrong, and he should work hard to prove his hypothesis wrong.
Well, you were more in a position as CDC director to be interacting with Secretary of State Mike Pompeo. So would you say that you had more information or more insight into what actually had happened or what was going on than Dr. Fauci did?
Well, I know I had a very high security clearance to work with the State Department and the National Security Group, including the Secretary Pompeo, where we reviewed material together to try to help him understand what it meant scientifically. I don't know if he also asked Dr. Fauci to do the same, but I would say I had probably the highest clearance within the agencies within the Department of Health and Human Services, and therefore was privy to a lot of information, some of which now has been declassified. And I think as you see more and more of it declassified, people start saying, well, wait a minute, maybe we ought to look at this other hypothesis, at least with the same rigor, or I wouldn't even say rigor for the other hypothesis that had naturally evolved. It seems like there was just a general acceptance. And then, unfortunately, like I mentioned, those scientists in Lancet decided to almost try to power play you, that this is the only way you can think. And I think we're seeing now that there's an opening of the scientific community to say, wait a minute, we need to look at both possibilities and we need to be scientific about this. Within the task force, we didn't discuss this. Right? This was never on the agenda of the task force. The task force was really focused on trying to figure out how to protect the American people now. I will tell you, in the National Security Group, because back in the early days, even in January, I was meeting with them a couple times a week. They were on this, right? And so they were kind of doing this. But when one of the members of the task force asked me, you know, why I didn't express that at the task force meeting, I said, well, it was never on the agenda. We never talked about origin of the virus within the task force meeting. So it was always something that was more being worked on by the security side. And I got to go on both sides because I worked with them. And then I got to, you know, be involved because different members, including Secretary Pompeo, asked me to help them understand what this gobbledygook virology language meant, you know. And so we didn't focus on origin. And it does show something that needs to change. There needs to be much more integration and harmony between the public health science side and the national security.
So you were consulted by state, and you talked to me about that already. What about National Security Council?
We've talked to a number of members of the National Security Council. As I said early on, in January and early February, I met with them quite frequently. It was before the coronavirus task force, really, the vice president came in. So there were people really looking at trying to get at this information. I think the error that was made, as I mentioned earlier, was not doubling down on demanding, getting the president to demand that the CDC get in to help evaluate this pandemic in January 2020. I think if we had, we would have been able to make a lot of corrections in our thinking that would have impacted the American public.
That's something. Dr. Siegel joins me now, along with David Asher, who last year led the State Department investigation that Dr. Redfield discusses in this interview into the origins of the virus. Dr. Siegel, it's a remarkable interview. We are very glad that you had the opportunity to do it, and I want to let everyone know that there's more of this interview that is coming in the show, and you're going to see the biggest part of it that you have seen all day on this program. But Dr. Siegel, he says something at the end there that really catches my attention. If we had paid more attention to the origins of the virus, if this conversation had been allowed and encouraged in the task force and at the White House, we could have made a difference in American lives. 600,000 people dead as of today.
Absolutely, Martha, and here's why. And he said this to me. It's because if the virus was manipulated and made to be like no other virus has ever been before, it would explain why it's so highly asymptomatically spread. It would explain why it causes this tremendous inflammation that we never saw with other viruses. Those characteristics are more consistent with something that's manipulated and leaks out of a lab. And the idea that not only was this suppressed initially when he was the only one with the high-level security clearance, and he had his hand in both sides. That's why he's saying it's got to be more disclosed. But he said that the task force wasn't even putting it on the agenda to talk about this. But I just told you why it's important. Because if you knew that asymptomatic spread was the thing, Dr. Redfield told me he would have had a Manhattan Project of testing like South Korea had. Let's test everybody over vast tracts to see if they could have had it asymptomatically. But we were going by a model that you had to have symptoms at first.
You know, I mean, this may sound like a strange, segue here, but David Asher, I want to play, this is John